now moving into part 3, Fukushima and COVID-19. What have we learned from the two crises? Let me introduce the panelists. Moderator will be served by Dr. Funabashi, Chairman of the Asia-Pacific Initiative. Panelists are the Professor Kazuto Suzuki, who is the chair of the 10-year investigation commission, as well as the member of the independent investigation commission on Fukushima accident, as well as for the independent investigation commission on the Japanese governance response, and also Mr. Shiozaki, the partner at Nagashima Ono and Tsunematsu, who is the co-chief examiner, for the independent investigation the commission for the COVID-19, and Ms. Hashimoto, editor-in-chief. So, Dr. Funabashi, please. Fukushima accident and COVID-19 from the two investigation commissions, what we have learned. That is the topic of this panel. The three other people who have been the members of the working group for the Independent Investigation Commission on Fukushima nuclear accident, and this time as well for the COVID-19. They have once again participated in the investigation. So for the past 10 years, for 10 long years, we have always thought about what to do with governance. So during the morning as well as afternoon, I have listened carefully to the discussion. There seems to be some common lessons to be learned from both cases. So what I would like to do is to focus on those issues. If I may ask Ms. Hashimoto first. In the case of Fukushima accident, within the 20 kilometers of the Fukushima Daiichi nuclear power plant, the residents had to be evacuated. Those who were patients at the hospitals, what about the care for those people and how to evacuate those patients? This must have been a very difficult process as compared to the ordinary people. That's to say, how to treat the vulnerable during the disaster. Hashimoto-san, you have made a detailed study of this. And for COVID-19, the healthcare workers at the forefront, they have huge responsibility. And how to prevent the collapse of the healthcare system, that holds the key. I'm sure you have investigated on that as well, looking at these two cases, the doctors, the healthcare workers in the hospitals. For both cases, what has been the challenges for them? Look from their eyes. Looking at the hospitals and medical institutions, of course, doctors are asked to have very high level of ethics. That is what is required from the society. But then we need to have education. And doctors and healthcare workers also need to evacuate together with the patients. And at this moment in time, we should not put the burden only on the hospitals. So if you could give us your comments from that point of view.
Thank you very much for the question. The medical practice on the ground compared to 10 years ago at Fukushima accident and the response to COVID-19 this time around, there are similarities. In the morning session, Dr. Suzuki talked about the limitations of homework-based regulation, and preparedness was lacking. We're faced with the virus now. Back then, it was nuclear power and radiation, an invisible enemy, and risk communication. So there are many common threads. We are facing the same problems. So to start, homework-based regulation, as Dr. Suzuki said, be it nuclear power or healthcare, these are regulated industry, and the players are the private sector. So from the government, homework assignment is given, and people on the ground have been responding to that requirement. But when you have homework-based regulation, you're assuming that the regulators know everything. But when we are confronted with an unprecedented situation, when things are changing all the time, that's a difficult thing. So there has to be good feedback of information between the two parties. What are the challenges? How should they be solved? There should have been better interaction at the time of the nuclear accident. How it was responded, I don't know fully, but in the case of COVID-19, in the fall of last year, administrative notifications, more than 600 of them have been issued by Ministry of Health, and that number is going up still. So when notifications are coming up at that rate, people working on the ground were having a lot of difficulty meeting those demands. And the second point about preparedness, lack of preparedness. As Chairman Funabashi said, evacuation from hospitals. Back then, at the time of the nuclear accident in the neighboring area, every year there were evacuation drills conducted. Residents and Futaba Hospital, about 4 or 5 kilometers from the nuclear power plant. They weren't assuming a situation where all the patients needed to be evacuated. So preparedness of such an unexpected incident, this time around COVID-19, starting with border measures, or starting with the charter flights to Wuhan, Diamond Princess, school closures, and until declaration of state of emergency was issued, what should be the response to what kind of situations? How was the government prepared? And to the invisible enemy, we are still battling this virus, an invisible enemy. And the level of fatality and infectiousness in the case of COVID, and in the case of nuclear power, it's radiation. We need to really understand by relativizing things. You have to have a correct understanding and have the right amount of fear. Were we able to do that? This is something that is common between nuclear power and COVID-19. And communication in responding to a crisis. In the case of COVID or nuclear power, there are still challenges. So these are the issues and challenges I recognize. I will ask you again.
Shiozaki-san, I have a question for you. In the Fukushima Independent Investigation Commission's report, Prime Minister's Office Crisis Management, that was what you covered in the report. It's a pretty impactful report. It was reported quite a lot, cited very often. Now, you served as the co-lead investigator under Kante Prime Minister's office. You addressed that issue. Now, comparing that time and now, what's the function of the PM's office, Kante? At the time, the administration was under the DPJ, but now it's LDP. Does that have any? Is that relevant? In the discussions, central government and local governments relation was discussed, especially prefectural governors, their authority, responsibility, how they should be. I think there are many issues. Would you like to make a comment? Thank you. Fukushima nuclear accident and COVID-19. The characteristics of the crisis is different. This drawing a simple comparison is rather difficult. But on several points, pretty different. That's my impression. First, Kante, Prime Minister's Office decision-making function. PM's office, what's the role that they are expected to play in emergency? across several ministries and agencies, not just ministries and agencies, including local governments, when the national crisis straddling all those different entities, various organizations, institutions have to be coordinated and make an overall decision that rests with the PM's office. The decision-making process. At the time of Fukushima, time was suppressed. It was led by politics, politician-led, bureaucratic organizations or other institutional response. There wasn't much time or preparation to utilize that. Now, COVID-19, in response to COVID, it actually progressed in several months as a unit of time, where there were issues, MHLW, or the group of experts, local governments, and a certain meeting and a certain process for decision-making. Regarding that overall coordination in terms of institution or in terms of organization, it was better organized. Having said that, in organizing all those different entities, as I asked questions in interviews with the pandemic, when asymptomatic infection, that was not really expected. Certain government officials said that there was no template. So in this COVID response to COVID, again, there were some trials and errors. The function of commanding tower, the command function, it turned out to be okay in certain cases, but in Fukushima and also in COVID, a real hands-on training or simulation, had that been conducted enough? This is one of the areas where we really should do some soul searching. Another function of Kantei PM's office, Hashimoto-san mentioned this, risk communication and crisis communication. The final, they are the ones that they should be trusted by the people. That's the kind of organization that they are, PM's office. In crisis, policies that would have a lot of impact, burden on people, asking people to cooperate, to bear that burden. In order to do so, political trust or political capital or political that will be necessary. In Fukushima and also in COVID, they didn't enjoy so much trust to begin with, so much political capital to begin with, and they had to keep making efforts. This is pretty difficult, but in keynote I touched upon Dr. Omi's comment. Individual risk, the right explanation, not just limited to such right explanation for each risk, showing the overall picture about response to the crisis, that sense of ease, peace of mind, reassurance, was that really conveyed and delivered? I think there is still a remaining issue here. In the last panel, when we discussed the Fukushima accident, point of type of evaluation, appraisal in that kind of organization, just to say the right answers. That kind of a culture is nurtured in the point-of system. But in addressing crisis, if you're just talking about the right things that you have already known, it's difficult to share with the people the future forecast or the direction. It's not just about the right or wrong yardstick, but showing the pathway, strong, encouraging words. A lot of people expect that from the government as a result of the two crises. That's how I felt. Thank you.
Turning to Suzuki-san. In the case of Fukushima, there was NISA and Nuclear Safety Commission. These are the two authorities, Nuclear and Industrial Safety Agency and Nuclear Safety Commission. And now we have Ministry of Health, which is the authority be it pharmaceuticals or vaccines. So the way that regulation is provided, comparing Fukushima and this time around, I suppose that there are many challenges. Suzuki-san, what is your view? Thank you. In part one, I talked about this a little bit. As Hashimoto-san said, homework-based regulation. The regulator is supposed to know everything, understand everything, and all the conditions are set, coming up with regulation requirements, and the recipient, the operators, or in the case of Ministry of Health, it will be the public health centers and pharmaceutical companies who are regulated. They are just looking up at their bosses, the regulators. They can just satisfy the required regulations, and that will suffice. For example, the issue of vaccines. What is pointed out is that in the past, Ministry of Health was leading a convoy method, all the pharmaceutical companies, to protect them. So internationally, small-sized pharmaceutical companies, under the guidance of Ministry of Health, they were allowed to conduct R&D. And as a result, because of aging population and lower birth rate in Japan, a vaccine is something that this is preventive. So communities where there are many young people and children, preventive medicine makes progress. But in Japan, because of a larger proportion of elderly people, treatment drugs is the mainstay. So in peacetime, how regulation is provided in peacetime tends to have an influence. Because the system is designed based on the peaceful times, but when you have a contingency in a crisis, how should it be regulated? How regulation should be eased? To what extent? That is not exactly clear. In a different way, in crisis times, you don't have enough imagination for crisis times. When you're not prepared for contingencies in the area of regulation, when there is a crisis, to what extent should you relax the regulation? What should be changed? At the time of Fukushima, information was not coming in. Normally, NISA should get information from the people on the ground, and the Prime Minister's office should respond based on that, which was the Nuclear Emergency Response Headquarters at the Prime Minister's office. But NISA and Nuclear Safety Commission, when they are not able to get sufficient information, this was a setback in the initial time, so it didn't function. And as a result, the government, they had set up a joint emergency response headquarters with TESCO. This wasn't provided for in the law, so this was extra legal measure that was taken. So preparedness of the government and the governance, when you are not prepared for that, then you have to go outside of the legal framework to take measures in crisis times. So you're out in the wilderness, and you have to put together rules on a makeshift basis. So homework type regulation is such that when you have an unexpected incident, you're vulnerable. In part 2, Dr. Suzuki, former MD, said that this time you have asymptomatic patients infecting other people. This wasn't expected. When you're not expecting such a thing, then you're not prepared. So after the fact, you'd be adding regulations. So that's why many notices were issued. As Hashimoto-san said, huge numbers of notifications had been issued from Ministry of Health to health centers and localities, local governments. So local governments were inundated with huge numbers of notices, couldn't keep up. Because of the system in the normal times were brought into crisis times, you are adding on regulation where there are no rules to start with. That created a big problem, in my view.
At the time of Fukushima, NISA's inspectors from the Fukushima Yoichi, he was in the off-site center. He was not really at the ground, at the forefront. You remember that. So as NISA, together with employees, of course, they couldn't say they should stay because the NISA didn't have the legal authority. So it just gave blind eyes to the fact that this person was at the off center, not at the forefront. At the NRC, the head of the organization, Dr. Charles Cust, who's also participating in this online meeting, when we interviewed the doctor for this report after 10 years, in the United States, together, those regulatory officers also fight together with others because regulations and the regulatory officers, together with operators, they are expected to impart their wisdom in search of higher level of safety. But looking at Japan, in the case of Japan, regulatory officials and inspectors, as Dr. Suzuki said, there's a given homework, and so you are demanding the right answers, just playing a role of an inspector. The regulatory approach itself needs to be changed, especially with technological innovation. Daily, Matsuda-san used the expression of update. It needs to be updated constantly with technological innovation. Now, new technology is something new. It's a risk. So this is a risk. This is not welcome. With that kind of approach, that would really turn into safety myth. That's about the regulatory approach or the ideas or ideology. This needs to be changed. What do you think? I think you're right. In the report after 10 years since Fukushima, from the homework type to effect-focused type, regulation should be changed. I discussed that. And as Dr. Funabashi, as you said, those regulatory officials, they're not just merely inspectors. Together with operators, they have to enhance level of safety. They share the same goal together with operators. And ultimately, for the nuclear power plant safety, they have to work together to achieve the safety. That needs to be shared. But in the case of Japan, there's this inspector and there's this operator. Those who are from the regulation and then the operators, they have to be separate. If they are together, the people say that now that's the regulatory capture or there is a collusion, and making it difficult to pursue the shared goal. Perhaps that's one aspect of Japan. In the first part of today's symposium, it was mentioned, infallibility. So the regulatory authority must know everything. They should never err. They should never make a mistake. So that kind of, in a way, they are shackled, and that's what's expected of them. Based on that assumption of infallibility, so the regulatory authorities are omnipotent. They know everything. And then operator who might cause an accident, and this omnipotent regulatory authority is there on a separate entity. As long as you have that kind of understanding or ideas, the regulator and the regulated, for them to pursue the shared goal, it would be rather difficult to do so. And I think you're right that we need to fundamentally change that. But because of this system here in Japan, the regulatory authority and those regulated, the operator, that relation it's difficult to change. And in the case of nuclear power plants, operators' interests actually might distort regulatory authority. Operators' benefit reflected to the regulation. Maybe the regulations will themselves become distorted because of that suspicion. The regulatory authority is going away from the operators. As a problem, we see this problem, and as you pointed out, Japan's regulatory issues have not been resolved. In a way, this has been deteriorating in certain aspects.
Turning to Hashimoto-san, as has been discussed, politicians and experts, dialogue between the two, or partnership between the two, how the dialogue should take place, how do they work together? Fukushima and COVID-19, making a comparison between the two, we'd like to think about this. In the case of Fukushima, Mr. Naoto Kan was the prime minister, and as Mr. Nomura said earlier, to a certain extent, try not to be impolite, he graduated from Tokyo University of Technology. He probably was confident of his technical expertise. Haruki Watanabe, chairman of Japan Atomic Energy Commission, was providing advice, but Prime Minister Kan said that he should only provide answers to his questions. Mr. Madarame flinched. So I think the dialogue between the two must have been strained. There were other science advisors, but the dialogue must have been difficult. But compared to that, this time around, as was discussed earlier, Mr. Shigeru Omi, a heavyweight, Mr. Abe, the Prime Minister, and Prime Minister Suga, dialogue between these officials, I feel that there is deeper dialogue taking place this time. But sometimes experts become too forward-leaning, and go-to-travel didn't work out so well. So it's still in a trial and error process. Making a comparison between the two, what would you say? At the time of nuclear power accident, the interaction between experts and government officials, I didn't cover that very much, so I don't know too much about that. But this time around, we had wave 1, wave 2, wave 3, and between the government and experts, the relationship has started to change and evolve. But on a slightly different note, still experts in their respective positions, they're doing their best, sometimes mustering their courage to make statements. That is what I feel every day. It's true that when you look at the experts, there are different age groups. It's interesting. Mr. Omi is in his 70s, and Dr. Omi and Dr. Okabe, in novel influenza in 2009, they were very active. They are like father figures, and we have younger people like Dr. Nishiura. Such experts are emerging. So younger experts, in a good sense, they say what they want to say, more free. So as experts, sometimes it doesn't work. How to communicate to the Prime Minister's office, you need to have multiple equations. So Dr. Omi would become the middleman, and sometimes the younger people would not be satisfied as to how the message was communicated. But the balance was taken. So information from experts, how that will be used and reflected in policy making. Yes, there are many challenges, and it's not that experts are always respected in terms of their opinion, but improvements have been made to what it was before. And talking about regulation, let me just touch upon regulation. Score deduction method was discussed. People working in the government agencies, it's the score deduction methods. In order for their scores not to be deducted, they want to step up regulation. That hasn't changed. But when you are responding to a crisis, resilience, flexibility is important. So how can you make a change to that through the course of crisis response? This is what I have identified as a need. Things are changing. The answers are also changing. So how do you run the PDCA cycle? You get feedback and put that into your planning process. You have to run this cycle. So you need to get opinions from the experts, and sometimes a rule can be withdrawn the day after. You admit that you have made a mistake the day before to make an improvement the next day. If you are able to do this and run this cycle, then you'd be able to do a better job at policy making, taking into consideration experts' opinion.
Thank you, Suzuki-san. Politicians, experts, scientists, engineers, you look at partnership and compare Fukushima and COVID. What do you think? Fukushima and COVID, nuclear and infectious disease. It's rather difficult to draw a comparison because with nuclear, it's a sensitive technology, so experts and people, there's a big distance between the two. Japan was exposed to radiation with an A-bomb, and on nuclear energy, the people have certain ideas about nuclear energy. So experts, nuclear experts, engineers, scientists, in dialogue with people, they are not really at the forefront. To put differently, communications with people, that's Agency of Natural Energy, Natural Resources and Energy, or METI, the government's role. That's how I see it. On the other hand, interestingly, if you look at infectious disease, experts always demand behavioral changes because amongst people, infectious disease gets transmitted. So there must be movement. People must take actions. And the behavioral change is built in the work on the part of experts. That's one characteristic. In the case of nuclear energy from society, it should be distant, and it's okay. It's better and more convenient that it's away from the society. Now, in the case of infectious disease, communication with people is very important, and that's a given assumption. So in terms of nuance, there is a difference between the two. Because of that, so far, Dr. Omi, Dr. Oshitani, and in polio and novel influenza, they have the past track record who are engaged in such activities. There are such experts. And although forward-leaning manner, they were involved in making, formulating policies. As a result, they ended up having influencing power. More or less not involved with people, in a kind of a hidden place. There are many scientists and experts in the case of nuclear. So with regard to the relation to policies and communication to general public, it didn't really work out. I think that's a major difference between Fukushima and COVID. Technology or scope of expertise, in terms of those perspectives, they were different as well. Another important thing, leadership from the politician side or politics. The receiving end of the expert knowledge. Dr. Funabashi and Hashimoto-san, you mentioned this as well. In the Fukushima nuclear accident, the Prime Minister was from TITEC, Tokyo Institute of Technology. He thought that he knew about nuclear technology more than others. Then experts' opinions were not really listened to. People were not trying to incorporate experts' ideas in policies. But in the case of infectious disease, they had no other option but to listen in to experts, especially in the second part. Hashimoto-san, I think you mentioned this as well. In the beginning, the school closure nationwide, there was an initiative taken by the Prime Minister's office without the input from the experts. Decision was made. But it didn't work out very well because they were in conflict with the scientific decisions. Then it's wrong to pursue such policies. Because of the failure of such policies, they made a switch to listen to scientists. So people who are on the receiving end, the politician side, that's also important.
Thank you. Then I have had a question to Ms. Shiozaki-san. We had heard from Dr. Suzuki, the former Chief Medical and Global Health Officer, and also Takenaka-san and others have emphasized the importance of preparedness for emergency. Of course, quarantine is a frightening word, so people do not want to hear those words. And emergency also has frightening connotation as well. But what would be very important as national paradigm for us going forward. Even the words tend to matter. They try to exclude uncomfortable words, but how can we build in the emergency preparedness in terms of organizations, in terms of legislation? How can the government and public sector work closely together to try to build up the better scheme? What is not expected needs to be expected and be prepared for that. To bring the risks to zero, as if that is possible. That should not be the premise. You do not have the capability to think about emergencies. You would not be able to prepare yourself for something totally unexpected. As Mr. Suzuki has mentioned, whatever the scenarios were simulated under homework-based regulation, something would happen that is beyond our expectation, does happen, because we didn't expect it, but it does not mean that it will not happen. Something we have never envisaged could also happen. And having understood that unknown will happen, then we can prepare ourselves. What is different between the emergency and the normal times? We need to have a trade-off decision. We need to ascertain the risks and make the relevant decision. And to be prepared for this process, we should not just think in our heads. We need experience. In terms of Prime Minister's office, in the case of Fukushima and the pandemic this time, there may be one difference in the background. In the case of Fukushima accident, the administration was in place only for 1 year, and then this major accident happened. For this pandemic, the Abe government had many years of experience as being in the administration. So the Prime Minister's office and the government as a whole is highly complicated, the machine or mechanism trying to build up the necessary system. I don't think all at once you will be able to know where are the experts and what departments are relevant and where lies the possible solutions. But if we cannot expect every administration to be long-living, we need to have simulations in place and have training and drills normally and routinely. In the case of Fukushima, as well as pandemic, when I ask the question, did you have training? Did you have drills? They say yes. But what kind of drills? What kind of training? They have a scenario, ordinary scenario, which is within the expectation in terms of scope. And then the Prime Minister at the end would make a speech. You have done well, and please do the same when at the time of emergency, and that's all. For the decision makers and policy makers, they do not have any experience at all. If you want to undergo training, Prime Minister should come up with many scenarios with a lot of uncertainties, about 60% of possibility to happen, and to be prepared for totally something unexpected. That kind of experience need to be accumulated. You forget about the heat when the fire is over. That is the human nature. But how to remember the heat always, even though you're not witnessing the fire right now?
I only have 3 minutes left. Though we have so many questions that are coming our way, we cannot take them all. It may be 1 or 2. This is from Mr. Kenta Murakami. This is our colleague working together on the investigation commission. Regulation being infallible, that would be a big problem for innovation in regulation. But regulation continuing to change, that means that the goalpost would not be visible clearly. Including investment perspective, predictability would be lost. That may be a concern. How to strike the balance is very difficult. Any good ideas is a question. Dr. Suzuki, just one word. This is a very difficult issue. It's true that when you have a goalpost, you feel more secure, and when you make an investment, it's easier to make that judgment. So it's useful and convenient to have a goalpost. And that is why homework-based regulation was valued, because it's stable. So the private sector, investors, and the government were following that, adopting that model. But in order to feel more secure and it's easier, and whether it's a good idea to continue with that homework-based regulation, that's a question. The issue of safety, in the end, investors, based on the convenience, small-scale comforts. For small-scale comforts, even if they are following homework-based regulation, that would sacrifice large-scale safety. So regulation has to be outcome-based regulation. I'm not saying that homework-based regulation should be dropped altogether, but nuclear safety, dealing with a crisis, how regulation should be, I think it should be changed more towards outcome-based ones. That means there is going to be less predictability. That is, indefinitely you would continue to try to make improvements, and that should be evaluated. For example, we're talking about ESG investments nowadays. On the issue of the environment, there are no clear goals, but you would get credit for making improvements. That is how people should be credited and evaluated.
Thank you. The goalpost when we speak of goalposts, the goals may not be that visible, and that may be the normal state in many cases. So inclusive of that, we need to update our plans, our trainings, and we should not leave anything to be unexpected. I would like to thank the three panelists. We were able to have very rich debate. Thank you. Lastly, on behalf of the organizer, the chairman of Asia Pacific Initiative, Dr. Yoichi Funabashi, will give his closing address. Thank you for the whole day, from the morning to the afternoon. I would like to thank all of you who have participated in this conference. By gratitude. It was a long day, but in a sense, it may have been a very short day. But it was highly productive and educating meeting. So I would like to thank all the panelists, especially the keynote speaker, Professor Suzuki, and Mr. Shiozaki. I would like to express my deep gratitude. Today, we had close to 300 participants, even from overseas, from 9 countries. There were participants from the United States, from the UK, Germany, and Australia, as well as Ukraine, Singapore, the Philippines, and Colombia, and also Republic of Korea. That we had online virtual the meeting. We were able to have so many participants from different places. It was sad that I was not able to meet you face to face and not being able to socialize with you, but there are strengths to virtual meetings as well. We could have a global reach, perhaps because it is being conducted on an online basis. There are many takeaways for myself. There are many things that I have taken note of. In particular, for the first half, when Fukushima nuclear accident was discussed, the capacity utilization rate to be enhanced may have been basically the goal for the licensee. And the biggest risk as they perceived may have been something to prevent that to happen, rather than risks to do with safety. Anything to prevent capacity utilization rate to be improved may have been placed as a bigger priority risk. That was pointed out. Now, from the beginning to end, we were discussing risks. The Independent Investigation Commission says that we should not sacrifice the large-scale safety because of small-scale comforts, not to give priority to small-scale comforts, and we should not forget the large-scale safety. We should always look at the whole picture. We should not base ourselves on distorted logic and dynamics. And truth be told, where the Japanese people would be able to barely accept the risk, what is the level of risk? In that sense, how can we be able to gain consensus so that we will be able to be prepared for anything that may happen? We need political leadership, and how to go about. The process needs to be established, and how to communicate. All these matter very much. there are anxieties and mistrust among the general public. If so, with all these risks, I don't think the public will be able to accept, even if they are asked or told to do so. This is a problem. So, the political leadership and how to take decisions and communication process, as well as governance, all these are key factors. And this is also related closely with the COVID-19 issue, as we discussed in the afternoon. Our think tank, as I have mentioned in my opening speech, we have established ourselves and placed emphasis on examination and make recommendations upon review. And in October, for the government of Japan's response to COVID-19, we have made public a report last year. Not only Japan, but the East Asian countries, how they have coped with and responded to the COVID-19, how they have responded to the first wave, and when, during the summer, it has subsided, and what kind of preparedness have being undertaken or not undertaken. And what about the third wave? And what about the vaccination? Inclusive of all of these elements, what is the response right at this moment in time for the major countries of East Asia? Together, I hope that we will be able to have a further evaluation. I would like to take about 1 year or so to have a good review of the matter. And when we come up with the good results, once again, I would like to make an opportunity to report back to you. As I have mentioned in my opening speech, an independent think tank in the private sector, not just think tanks, but intellectual centers such as universities. I believe it is important also to evaluate the school education process as well. And we need to share what we have found with the whole world. That, I believe, is also important. And our think tank, fortunately, for our ambition and our goals, there are those who understand deeply. There are such parties, including businesses, who support us. And with those support and with those kind of cooperation, we are able to have our activities. So lastly but not least, I would like to thank all the supporters. Thank you very much indeed.